Hello everybody, welcome to today's discussion or conversation. We are going to be doing something a little bit different with this series. My name is Magali De Castro. I'm the clinical director here at HotDoc, and you may know me from a lot of the webinars that we do and the kind of CPD and training sessions. But we thought there's already a lot of clinical information that is out there. There's a lot of logistics information and procedural information that is being distributed, and by the same token there's a lot of information on mental health and support services that are out there with everything that's going on with the COVID-19 pandemic. So things like Beyond Blue is doing a lot of work with support hotlines and things like that, but also the PHNs, the primary health networks. Several of them now have programs to support staff of clinics who might be struggling emotionally or with mental health wise. But having said that, we thought, well, it might be good for someone who's kind of sitting in the middle and is just wanting a little bit more, like just some practical tools or tips, or just to have a bit of a conversation and learn from one another in terms of what can we do, how can we enhance our awareness about ourselves, about what's happening, what can we do from a self-care point of view, and what are some of the practical tips and things that we can use to get us through. So for that, we've put together this sort of mini series where we're going to be looking at specifically that, the emotional or mental health impact that a lot of these things are having on us as people who work in clinical settings, be it admin staff, reception, practice managers, owners, GPs, nurses, allied health, all of us going through this. So yes, so as part of this session, I've got a colleague of mine, and also very dear friend, Kylie Zeal, professional certified coach. I actually met Kylie about 9 years ago when I did my first health coaching course. So she was actually my introduction to coaching, and I fell in love with the concept of coaching so much because that was one of the first times that I actually got to experience that real person-centered care. And again, we take that for granted a bit now, but this is kind of going back almost 10 years ago when that seemed like a newer sort of thing. So yeah, ever since then, obviously I've introduced coaching into everything that I do with health promotion, chronic disease management, and in my life. So Kylie's actually my personal coach. So yes, I have a personal coach that I use. Remember back in the day, hearing how, it's not your weekend warrior who has a coach, it's an elite athlete who has coaches. And so it's like, well, if you want to be playing elite in any aspect of your life, be it your life, then you should get a coach. That made sense to me, and so I've got a coach and I love it. And I use it in my life for all sorts of things. So I think Kylie's going to be the perfect person to have these conversations with. So welcome, Kylie. Thank you for joining us in this discussion.
Thank you so much. I got so many warm and fuzzy feelings as I was listening to that. I've always admired that attitude that you've taken. If you want to improve in your life and be the best version of yourself, that you look for tools, the resources, putting people around you that can help you do that, because nobody gets there on their own, do they?
Yeah, exactly right. So I thought we could go through a bit of a series of different conversation topics. I thought one of the most topical at the moment is verbal abuse. So how do we, working in clinical settings, deal with the verbal abuse that a lot of us are facing when we're at the coalface? And obviously in clinical settings, we have this as an issue all the time. So at any given moment, pandemic aside, you have people who are stressed. So patients are coming in, they're stressed. It might be their family members. And so the stakes are high, tensions are high. And so you have incidents of verbal abuse or even physical abuse. Now, I just want to make the distinction. Today, I want to look at we're not going to be talking about physical abuse. We've actually covered that in other webinars in the past. I want to look at verbal abuse, but most importantly, what do we do from our end? So what's the impact for us as receptionists, practice managers, clinicians, and how do we look after ourselves so that we get through it and then in the most balanced way, and then we obviously come out either better than before or the worst case scenario, just unscathed, emotionally unscathed, that is. So one of the things that I wanted to talk to you, Kylie, about was we're seeing, obviously with the pandemic, There's been a lot of anxiety in the public, the general public, which meant we had more phone calls, also clinics, us wanting to make sure that we triage people so that we don't have people who are potentially infectious coming in. It means that the phones are going crazy, people are on hold for longer, people get really anxious, they stress out, and then they lash out at the poor receptionist or whoever's kind of manning the phones or trying to help. So that was one issue, which was the original issue that I wanted to talk to you about. We actually have a developing issue now, which is adding fuel to the fire. Now we have this push of the government is really promoting that people have their flu shot as soon as possible. So get your flu vaccine now from your GPs, get it as soon as possible, contact them now. But here's the problem. The stock of flu vaccines is either delayed in some states or in some cases, or it's being limited. So they're just kind of trickling it through, drip feeding it, 50 at a time. So as you can imagine now, what we're dealing with from a clinical point of view or from a practices point of view is patients getting on the phone, upset and angry and kind of yelling abuse because the TV said that I should be able to come to the clinic and get my flu shot today, and what do you mean that you don't have it? Yeah. So that's one thing. We're getting that there's this mismatch of expectation versus reality. There's some people feeling like maybe we're holding out, like it's like we do have the vaccine, but for some reason we don't want to give it to them. And then also internally, we have practice managers getting the practice owners or even the receptionist going, do we have the vaccines yet? Why is there a delay? Are you sure you put in the order? Have you checked that the order went through? And it's like, well, guys, there's only so much any of us can ever do at any one time. So that's a lot of stuff to throw at you. But
I am just listening in awe of how much you all health practitioners take on every day, even before all of this. And that actually segues into the first point that I'm thinking about, which is maintaining a level of calm. That this is going to relate to all of the things that you just said. And it's definitely easier said than done. Like, oh, just be calm, just be calm. Hit that,
exactly.
Press the button and then you'll be calm. So I think I'm not about to start wanting to say in a way that it lands like that, just be calm, like it's the easiest thing to do. It's not easy. It's one of those things that's simple but not easy because you've got so many things coming at you all the time, and all of those things are having the opposite effect in many cases, causing the stress, causing you to engage with your fight or flight response. And the issue with that is it affects your ability to think practically, think well, basically. And so any amount of calm that you can engage with is going to help you move from the fear centers in your brain, which are all about immediately just protect myself, that fight or flight. I either need to fight back at this person to manage my boundary and keep them away or feel this feeling of needing to run away. So I just need to deal with this person quickly so I can get out of here. And those are all really natural human responses. So one of the first things I'd love to do is just really acknowledge everything that you're doing, Magali, that I'm doing, that everybody listening to this is doing, especially if they're in the health sector. So the first thing we want to do is acknowledge how well I'm doing, because it's very easy to see all of the things that are missing. Whilst it's good to be across those things because we don't want to forget them and we don't want to just disregard them, we don't want that to be the main thing that we focus on so that it's to the disregard of all the things that we're doing well.
Yeah.
So, and the way we know that this is helpful is just to notice how you feel in your body. If you take a moment to pause and breathe and go, okay, I'm going to list 5 things that I've already done well today. Straight away, you notice the shift. And that's all the evidence you need to know that that's a practical step that you could take initially.
And that's already a very good practical tip, like to stop And yeah, saying, well, bring in any level of calm that you can bring in is going to be helpful. So that's important to keep in mind. And calm for people is probably going to mean different things. But as you said, like, you feel it in your body. Like, that's the best feedback mechanism that you can have. Because even as I was explaining to you what the situation was, I could feel my own blood pressure rising. And I'm going, and then this happens, and then that happens. And so, like, checking in with yourself and going, oh my goodness, yeah, I'm going into that space of stress where you are in fight or flight, which obviously is needed for some situations, but in some times, like in some cases, it's actually going to be detrimental. It's not going to help you get through that in the best possible way. Also, it's probably not going to be sustainable. It's probably going to lead to you burning out, feeling more exhausted than you need to, and then obviously all those stress hormones. No good can really come of that long term. One of the things that you do when we do coaching, and I do when I do coaching with patients or clients, is this concept of, at the end of a session, what would you like to acknowledge yourself for? Which I remember, like, it took me by surprise, because I'm not used to kind of stopping to go, what am I doing well? And so it almost like takes you back and go, wait, what? And then once you start going, actually, yeah, that was good. Like, and I put myself out there, and I was vulnerable there. Or I really, did my best in that situation, and I gave it my all. It really does help to articulate and make it real, that thing that was maybe a bit untangible, but you did well. So I love that as a tip in terms of how do you get that calm. A very practical, quick tip. Let's stop, take a moment, and have a look at, we're doing a good job in some area. What are 2 or 3 or 5 things that we've done well so far today, or so far this week?
The other thing I was thinking about as well, because I'm sure that people listening, they're taking this on, but I was also thinking about the fact that, in the heat of the moment, if you've got a patient who's giving you a hard time because, where's the vaccine? The government told me to come and get the vaccine, and now I'm here and you haven't got it. Well, in those moments, it's kind of hard to go, just hold on. I'm going to take a moment to sit here and think about what I'm doing well. Let's say that the tip that we've provided so far is very practical for when you have some time to self-reflect.
Correct.
And I think we should also add in a tip for how you can calm yourself when you're in the heat of the moment and someone's actually right in front of you giving you a hard time in spite of all your good work. And on some level, they do appreciate you, but in that moment, it certainly doesn't look like they appreciate you. And that's where we need to do the reality check of, am I in physical danger? The point is to know that if I am engaging with my fight or flight response, that tension in my body, any sweating or shaking, or just you can't even think straight, these fight or flight symptoms are a sign that on some level I am acting like I am in physical danger. There is an imminent physical threat. And this is when we need to go pause and go, am I actually in physical danger right now? Because if I'm not, I need to acknowledge that I'm actually not, so that I can shift my thinking to what we like. It's called the prefrontal cortex part of your brain. It's the part of your brain that sits behind your forehead. And this is the part of your brain that you use for creativity and problem solving and coming up with any new ideas. And it's where we use planning and all the logical things, all the things that you would need in that moment to come up with a solution for this person who's standing in front of you. Problem is, you can't engage that part of your brain if you're engaged in the fear centers of your brain. Fear will override. This is why we sometimes think we can't think straight. So that's the other tip that I'm suggesting for in that moment, is to do the reality check and go, am I in physical danger in this moment? Well, if the answer is yes, then obviously we need to bring in some help, security or someone else. You should be handling that on your own anyway. But if the answer is no, I'm standing in front of a 32-year-old woman or man or whoever, or just doing a reality check and acknowledging who you have in front of you, and no, they're not about to lean across the desk and punch me. And that reality check helps us to go, okay, then I don't need my fight or flight response. I can calm down in this moment. And as soon as we start to calm down, that's when we notice that we can think a bit straighter. Another tip that I would suggest is empathy. Now, for
Yeah.
our audience in the health sector, like, we've got so much empathy as it is, but there are times when we're tested. When someone's coming at us and we're feeling threatened and that
Yes.
fight or flight response is being engaged,
Mm.
that's a blocker to empathy sometimes, because we're just thinking about how can I protect myself, or we're stressed and we need to manage our own boundaries. But it's empathy in that
Mm.
moment that's going to help us get our message across to whoever it is that we're dealing with. Because what's often the case in those moments is people, first and foremost, they want to feel heard. They want to
Yes.
feel
Yeah.
understood. I mean, the fact that they've said, oh, the government told me to come and get my vaccine, well, that's probably true. The government did tell them that. The
Yeah.
fact that we can't give them that
Mm.
vaccine is not,
Yeah.
well, it's not really their fault. It's feeling like their problem now because they're trying to do what they believe is the right thing.
So from that empathy point of view, so what are the sort of things? Because obviously empathy to me is that concept of understanding where someone's coming from, or trying to understand, even if you don't entirely understand where someone's coming from. So this would be, you've got the patient in front of you and they're going, but the TV said, but the government said that I should have this right now. What do you mean you don't have it? So what does empathy for me as a receptionist, or for me as a nurse in that moment, look like? How do I know that I'm being empathetic in that moment?
Great question. I'm hesitant around the word no, because sometimes it's something we can't ever know for sure, because it's about seeing the world through another person's eyes, walking in their shoes, and to the best of our ability, we can imagine what that would be like. We can ask ourselves, what would it
Mm.
be like to be them right now? So that's probably the
Yeah.
closest we're going to come to knowing, unless we actually ask the person. So if it's going to
Mm.
help with engaging with the other person, it might be, oh, I imagine this is going to be frustrating to be told by one outlet, the government, to go and get your flu shot, and then you get here and you've been told that we don't have the supplies to give you that right now. And I'm imagining that's going to be quite frustrating for you to hear. How are you doing
Yeah.
with all of everything that's been going on? And it can almost stop people in their tracks as well when you do
Mm-hmm.
that. When you ask a question like that, and you're coming at it with care and empathy, which is a quality that definitely exists in all the health practitioners that I know of. So I'm suggesting we don't need to necessarily push back. We don't have to force these boundaries. It can be about pausing and just seeking to connect with the other person and seeking to understand. And even if we don't know
Yeah.
what it is that they're thinking and feeling in the moment, asking the question rather than assuming.
Well, we often know that when, like, a lot of the frustration comes from people feeling like they don't have the right information or enough information. And the more someone understands about the situation, then the more understanding they usually can be. So, for example, in that scenario, if someone goes, but the TV said that I should be able to do it and get it here, or the government said that I should, then being able to, again, calmly, well, one, if you're acknowledging, I can understand that this is very frustrating because you're getting mixed messages from all these different sources. But then using this as an opportunity to also, like, educate and inform and almost get them on your side as well, or get them to, essentially giving them the tools so they understand the bigger picture. So unfortunately, what's happening is we haven't received the stock. We've placed the orders. They should be arriving. So giving almost like a direction of, yes, we don't have this right now, but this is what we're doing instead. So in the meantime, this is what we're doing. We're keeping track of everyone that wants a vaccine. We can let you know as soon as it's in. We expect that it's going to be in this particular time frame. So again, it's just like when if you're waiting for an airplane and there's delays, it's like you just want to be kept in the loop as to, well, why is there a delay? When are we expected to take off? What's actually happening? And the more you understand of that situation, then the more patient you can be. If you're just kind of kept in the, well, we don't have it yet, and that's all there is, then inevitably you're just going to get, well, but why not? It's like there's no explanation. I don't understand yet. Why? Is this your fault? Did you not do something that you should have done as a clinic to get this in stock? Are you holding back? Like, what's happening? So I think, having that awareness of helping understand. But if we go into the defensive, straight off the bat with someone that's bringing in already a fair bit of frustration and almost like they're ready for a fight, and we meet them with a fight, then ding, 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 like we've got the start of a fight. We've got both tensions hitting head to head.
Also loved what you said about what you would say to the person about what plans are in place, and we can let you know when we get the supplies back in. And as you were talking, I was thinking about how that would come from good communication with your internal staff and making sure everyone of the staff, your colleagues, are on the same page about what's going on to help prepare for when patients come in with questions about what's going on. And that's what I imagine is happening when you talk about clinics.
And a lot of times that's a good point to bring up, because a lot of times that doesn't happen internally. So the doctor might not know where we're at, the receptionist might not know where we're at, the practice manager has put in the order, has chased it up, but we haven't necessarily had the chance to get the entire team on board and go, okay guys, this is what's happening, we've put the order in, we can only order 50 vaccines per week and only for this age group, so this is how we're going to roll them out. So that from the same clinic, which can happen, from the same clinic, different people are giving the patient different stories, and that can become even more stressful as a patient, because it makes you go, wait a second, like the doctor said this, why is the receptionist saying something different? Making sure that as soon as you have any kind of updates that you're distributing that, and if you can't get everybody to meet face to face, then distribute it electronically, send everybody an email going, hey guys, this is the plan of action, this is what we know so far, this is what we can tell our patients, and this is what we're doing while we're on a holding pattern. Like, this is the advice that we're going to be giving to patients. I wanted to ask you also, one thing that you had said at one point, once you told me about, it's important to separate between the person, the issue, and your identity. When you're in that kind of fight or flight state, you're having a situation where you're having either an argument or someone is disgruntled or you're experiencing verbal abuse. And so something like that, like how would you practically put that into action, or how would that be useful to look at it in terms of separating the person, the issue, and your identity in that moment?
The minute you even ask the question, you're separating those three things. You're sort of taking a step back from what's going on internally, especially if you've got the fight or flight response engaging, taking a step back, calming down and going, look at the dynamics of what's going on here between the two of us, because it's so easy to take things personally. So taking a moment to separate and go, okay, well, who am I in this moment versus who are they? That's the empathy that we were talking about. And then what is the real issue at hand here? Because it's not about me personally, and it's very easy to get caught up in what does this mean about me? The fact that I don't have the supplies that they need, that's not personal. If I don't have the supplies that the government told the public that I would have, that is not my fault. But it's so easy for us to have an internal dialogue or messaging that's saying, what am I making this mean about me? Especially, again, coming to that point that we're in the health sector, health professionals are very caring, and we can start to feel like, oh, I've failed this patient because I don't have this medication, this vaccine that the government said I would have for them. And we begin sympathizing. It's different to empathizing. We begin sympathizing with how they must feel in that moment, and we feel for them. We literally feel their pain and we feel bad. And then in the same moment that we're feeling bad, we start to make ourselves a failure. So taking a step back, pausing, who am I in this moment? I have the skills. I am a professional. I do want to help this person. Let's make sure that I understand, how is this situation impacting them? What can I say in this moment that's going to, first and foremost, make them feel heard and understood, like I get where they're coming from. Even if I can't immediately resolve this problem for them, can I say or do anything that's going to help them see that I at least understand where they're coming from?
I think that's fantastic. And I think now we've been kind of talking for a while, and I think we've actually got quite a number of different tips and kind of strategies that we can take back to a clinic. And I'm going to try and summarize them because, again, we went through a lot of them. But one of them, the first one was, in that moment, try and find any level of calm that you can access is going to be helpful. So any level of calm that you can bring into that encounter is going to be helpful. So if that means just taking a moment, taking a breath, it might be, even if it's not in the heat of it, it might be after the confrontation or whatever it was, or if you just feel like you're having a particularly tough day, having that pause and going, okay, it's not all bad. Let's list, even if it's just a couple of things that I've done well today, that I've gotten, that I've managed to get through today, or that have worked well today, to shift that focus from everything is terrible and we're sinking deeper to wait, no, there are things that are going well, or there's resources that we can use and have been using. Another big one was getting the team on the same page. So even if you're not in a clinic that usually has very good internal communications, this is the time to get good at it. So it could start with having a regular communication. For example, whatever the particular issue is, right now it might be flu vaccines. Having a standard communication that goes out to all your team members about where are we at, are we waiting on stock, when do we expect that it's going to be arriving, what's going to be the advice for patients, and what are we doing about it, so that we are all on the same page and we're all giving the same message to patients. The other thing was empathy. So if we've got somebody coming through to us and they're very charged and they're very frustrated, instead of responding immediately with attack back or resentment or, I'm trying to do my best, why can't you see that? It's kind of going, okay, let's just take a moment and go, where are they coming from? And acknowledging that. It's acknowledging that, like, I can see how this would be very frustrating. And then that other tip of making sure that you're separating the person from the issue, from your identity. So what, just because someone is here and frustrated, this is not a personal attack. It's not meant to be because they want to disrespect you. It's because they're frustrated. So it might actually have nothing, and very likely has nothing to do with you. It just so happens that you're the messenger. So understanding that, so you can separate yourself from it, so you can kind of come to it from that detached point where you can be more balanced and more helpful actually in that situation. Anything else? Anything that I missed? I just tried to summarize all the...
Very well summarized, and I'm thinking about acknowledging all of our listeners, because I'm really impressed with what I've seen of how people are handling it. So take that on as the element we talked about with acknowledgement, and acknowledging all the things that you are doing well. And you said before, even if it's just one or two things that you've done, I agree with the sentiment, even if you can just find one or two things. And at the same time, you probably recall, Magali, that even when people struggle in coaching to tell me the things that they're doing well, I'll push for more, because we're not in the habit of acknowledging ourselves. So if you can get one or two, great, yes. But if I forced you to sit down and list 10, 20, even 50 things that you've done well, you could find them. They are there. It's just that we take so many of the things for granted and act like they're nothing, and they're not nothing. They are you showing up every day to this life, which is not easy. It can be draining, and that's even on a good day when we don't have this thing called COVID-19 turning our lives upside down. And so we really need to acknowledge even the small things that we do, because every moment is a choice. And those people are not choosing to sit at home doing nothing. They're choosing to show up every day on the battlefield, to use a metaphor. And all of the little parts that go along with showing up to that environment need to be acknowledged.
I think it's probably a good exercise even just now. So if you're listening right now, so far today, can you name two things that you have done? And not can you, I want you to. Like, find at least two things that you have done today or that have happened today that are good, that that you would like to acknowledge yourself for, that you'd like to pat yourself on the back for. And on that note, Kylie, what would you like to acknowledge yourself for this session?
I'd like to acknowledge myself for showing up here today. I haven't done a lot of podcasts, and there's certainly part of me that feels like I've just done my best and gone with what felt true for me in the moment, even if I will look back later and go, oh, I know I could have said something else, and I know I could have said something a bit differently. But that's why I'm really excited that we have more sessions already scheduled, because I'll reflect on what we've done. But that's true for everything in life. So showing up, that's the big thing. Just Showing
exactly.
up. Right?
Yeah. I'd have to agree. I'd have to concur. Just showing up. We're actually recording this on a public holiday. So it's that thing of like, oh, yeah, I could just take the day off. Or we could actually just make the time, do this thing, get it out there. I don't necessarily know who, if anyone, is going to benefit from this. But just in the off chance that someone might, worst case scenario, I've benefited from it because I got to have this, discussion with you and learn from all your tips as well. So I'd like to say thank you so much, Kylie, for that session, for your time today. I want to say if you want to learn more about Kylie, she actually has written 2 amazing books. So you can go to kyliezeal.com. So that's KYLIEZEAL.com, and you can find there more information about Kylie. The books are available on ebook format, Kindle. You can get them from Amazon, so you don't have to worry about shipping anything or ordering anything. And then we'll be talking a bit more about other bits and pieces in future conversations. Thank you so much, Kylie, for joining us. Anything else that you'd like to say?
Looking forward to the next session. I feel like I'm just getting warmed up now, so looking forward to it.
All right, thanks for that. Bye, everybody. This mini-series is presented by Hot Dog. For more resources and peer support, join our Facebook community For the Love of Healthcare, where thousands of healthcare workers come together to ask questions, share ideas, and blow off a little steam. And to learn more about how your practice can use Hot Dog to better engage your patients with online bookings, recalls, electronic patient registration forms, mobile check-in, and more, visit hotdoc.com.au. That's HOTDOC.com.au.